Hello, and welcome to another edition of the Stench of Truth. Today I'd like to talk about the healthcare crisis in this country and point out one example of what the real problem is. The University of Pittsburgh Medical Center, otherwise known as UPMC HMO, which is based in western Pennsylvania, is extorting the city of Pittsburgh, Pennsylvania, out of $100 million. Now, the reason that this all came about is because the non-profit UPMC healthcare provider entity made an excess of $680 million last year. Now, out of the kindness of their heart, they have agreed to donate $10 million over the next 10 years to the city of Pittsburgh for use in scholarships for city school children. Well, it would seem to be a magnanimous gesture on the part of some company giving away something to help the children. But what this does in effect do is tell us what is wrong with the healthcare system in this country. And in a letter to the editor of a local paper, a writer so pointed this out by saying that if they really wanted to give something back, why don't they give back all of the outrageous fees that they charge to all of the members who paid them, and are the reason why they ended up making an excess, which is just another name for a profit, which a non-profit is not allowed to make. So, if they're charging $680 million more than is necessary to run their business, then that's overcharging. That's like the defense industry back in the 70s and 80s when we would all hear about the $100 hammer or the $200 toilet seat. It's the same thing. Healthcare is overpriced. UPMC is extorting the city of Pittsburgh by saying that this $100 million gift, $10 million over 10 years, hinges on the fact that there are no taxes applied to non-profits, UPMC in particular, in the interim period of time. Otherwise, they want the city of Pittsburgh to reimburse them for the entire amount, dollar for dollar. Now, how is that even something that you can call a gift? It's outrageous. So, the healthcare crisis in this country is not about anything except for everything being overpriced. From the care you receive from doctors, hospitals, and good old UPMC, along with every other HMO provider in this country, as well as prescription drugs from pharmaceutical giants who charge ridiculous and outrageous fees, but only in the United States where we can afford it, because in Europe and in other countries they sell the exact same medication for a lot less money. Why? Because we have more money to spend. That's why they charge more for us here in the United States. Isn't it wonderful? So, beware the non-profit HMOs and the healthcare providers. They're the source of the problem, not anything else. So whenever anybody comes up with some idea about how to improve the healthcare situation in this country, if their answer does not involve changing the price structure and bringing it down for the entire healthcare industry, then it's not a real solution. Remember, UPMC is trying to extort a city in this country. by promising them one thing in return for no taxes. Could be a trend of something to come around the country, sort of hedging their bets against a future where they may be forced to pay taxes like all the rest of us. And who will make up the shortfall? You and me, like we always do. In the city of Pittsburgh, UPMC owns a great deal of property, and they pay virtually no taxes. This is true of every other non-profit around the country. So, non-profits making a profit sound like a bad idea to me, because if they're getting the largesse that they get from the government by not paying taxes, then they damn sure better not be making any profit. Because that tax money and that tax revenue has to come from somewhere. And guess where it comes from? You and me. Thank you. Good night.